over immunisation. What they're trying to do is debunk the claims by the anti-immunisation lobby over the dangers of vaccinating kids. The report, though, today says, in the Herald Sun, says there's been a six-fold increase in the number of people not vaccinating children, and the scientists say that could cost lives. I wanted to get two views on it. I mean, my view is pretty well known. I think vaccination is worth the risks, but I'm not expert. On the line, the president of the Australian Vaccination Network, Meryl Dorey. Good morning.
Good morning, Neil. How are you?
So you're actually anti-vaccination network, are you?
No, we're not, Neil. We're the Australian Vaccination Network, and we believe that everyone has the right to make an informed decision about vaccination, and that includes having access to both sides of this issue, because like all scientific issues, there are two sides. There are benefits and there are risks, and people need to be aware of both sides.
So you present the risks, correct?
We present information to balance the information that parents may get from their doctor or from the government. And the government and the medical community actively suppress information on the risks and ineffectiveness of vaccines. So, yes, we fill that gap. Why do they do it?
Yeah.
You'd have to ask them why they do that, but they've been doing it for many years. And even when information comes out, for instance, in the article that you're referring to that was out in today's paper, it says that we have a huge increase in the incidence of whooping cough in Australia, and that's because we have fewer people vaccinating. And nothing could be further from the truth. We actually have the highest level of vaccination in Australia that we've ever had against whooping cough, and the highest level of whooping cough that we've ever had. We have more whooping cough now than we had since before the vaccine was added to the mass vaccination schedule in 1953. And the reason for that, according to studies that are coming out around the world, is that the vaccine is no longer effective against whooping cough because the disease has mutated, and it may actually make people more susceptible to contracting whooping cough. And this information is out there. It's from the medical community, and yet the media doesn't cover it.
Oh, no, come on. No, you're not into this sort of conspiracy stuff, are you?
It's not a conspiracy.
Well, the media doesn't cover it. You're saying that the media is part of a conspiracy. We've got eminent scientists, Professor Fraser, Gus Nossel, eminent scientists and the media part of a conspiracy to cover it up?
You're talking about an appeal to authority by naming those names. I'm talking about the actual data that's available in the science.
I'm talking about your suggestion there's some sort of conspiracy here. I mean,
no, I didn't use that word, Neil. You did.
Well, all right, you implied it by saying the media won't report it. Okay.
Well, the media doesn't report it.
What the hell are we doing now?
Okay, that's great. I think it's fantastic that you're showing both sides, but that is a rare event in the media, and I'm really grateful to you for doing it. And I really think that it's important that people have open access to this information without the pressure, without the name-calling, and actually with access to the science. That's all the AVN asks.
Okay, well, in very simple terms, what is your objection to vaccination for the major illnesses?
I don't object to vaccination. I object to people being told that they have to vaccinate when that's not true.
So you don't object to vaccination? You're not recommending?
No, not at all.
Oh, okay.
It's everyone's choice. If someone wants to vaccinate, that's great. If they have made an informed decision either to vaccinate or not to vaccinate, that is their choice. We absolutely oppose any form of compulsory vaccination. Nobody should have to the right to tell us that we must vaccinate.
So do you recommend, though, not compulsory, but do you recommend vaccinating children against measles?
We recommend that when a parent is trying to make that choice, either for their children or themselves, that they speak with their GP, that they speak with natural health practitioners or any other practitioner that they trust, that they get information and do their own research, and then and only then make their decision.
So you are not willing to make a recommendation either way?
I'm not a health professional. How can I make a recommendation?
Well, you're telling us you're expert in the area.
I never said that. You said that. I have studied this issue for over 20 years.
You've just quoted me all this stuff about whooping cough, and now you're telling me you're not expert.
What's the definition of an expert, Neil?
Are you president of the Australian Vaccination Network?
I am the president of a consumer organization that believes that everyone has the right to make an informed choice about all health issues. If you think that makes me an expert, well, that's your opinion.
No, I would suggest that you're being a bit disingenuous here, that you are, in fact, the lobbyist against vaccination.
Well, I think that you're trying to put words in my mouth that don't belong there. And speaking of words in the mouth, I understand that on the television this morning, you said that parents who don't vaccinate their children are child abusers. I want you to know that hundreds and potentially thousands of people listening to this program are the parents of children who've either been seriously injured or killed by vaccines, and you need to keep that in mind.
I see, but these are the vaccines you're not opposed to, and now you're telling me they kill people. What I said was,
like all medical procedures,
what I said
vaccines have risks.
What I said was, in my view, and I stress that, in my view, and it's a non-expert view, parents who don't vaccinate their children, that is tantamount to child abuse, because I believe the benefits far outweigh the risks.
And that is your belief, and you're entitled to your belief. But as a member of the media, you have to be aware that your belief can be incredibly hurtful to the thousands of parents listening to the shows who have children who've been killed or injured by vaccines. And what I believe is that you need to be able to make that choice.
How many children have been killed or injured by vaccine in the past? Did she hang up on me? No, surely not. No, I wouldn't think so. We'll try and get her back. Actually, we'll try and get her back. But in the meantime, I'll just speak quickly to the President of the Australian Medical Association, Dr Steve Hambleton. Good morning.
Good morning.
Okay, where do you get the information that allows you to make a choice on whether you should vaccinate or not?
Well, there are several places you can get it. I mean, obviously there's government websites that have got information, but the Australian Academy of Science has independently, without any funding from government or from the pharmaceutical industry today, put a booklet out for parents really to help them make that exact decision. It's written in language which actually parents can understand. It deals with some of the myths that we hear, and it actually gives them the opportunity to make that decision. We hope the right decision.
So what are the dangers in general terms in vaccinating?
Well, there are dangers. Like anything, there are side effects. So the most common side effects are quite minor, and it's that redness of the arm or redness of the leg that kids get when they get vaccinated. That's because we're stimulating the immune system.
Yeah.
But if we warn the immune system about serious antigens when they get in contact with the real virus or the real bacteria, you've got a better chance of fighting it out.
Okay, but what are the serious side effects possible?
Well, there's very few serious side effects, but we do see children with febrile convulsions every now and again. That's a very major concern because we've seen some terrible side effects with the flu vaccine in the last couple of years.
Yeah.
Thankfully, that was recognised early, and that particular brand of vaccine was removed from use. But you know, the number of children who die from influenza and the number of pregnant ladies who ended up in intensive care with that last pandemic is basically. It reminds us how serious the flu can be.
Okay, so are you aware of the number of deaths as a result of vaccination, child deaths of vaccination, say, the past 5 years?
I can't give you that number, but the number is going to be very, very low. And I guess I can tell you that compared to getting the wild virus, those side effects, even those side effects of death, are far, far less than what you would get if you didn't have the vaccine on the market.
Okay, so we're accepting the point. There are risks. You say
Absolutely.
Mostly minor. There are some serious risks, but those risks are outweighed by benefit.
Yes, correct. And I think we have to be very honest with the public because they need to make an informed decision. If we can't hide adverse outcomes because they're part of the process. With any product that we deliver on the market, there are adverse events. And we've got to make sure we don't release things where the benefits don't outweigh them significantly.
But what these figures, that there's been a six-fold increase in people refusing to vaccinate their children. Why?
Well, I think there are a number of reasons. I mean, one of them is that a lot of these diseases aren't around and aren't circulating. So parents have never been exposed to a kid with measles, for example. And seeing a child carried into your general practice with measles, gee, I haven't seen one for 20 years, but the kids are really sick, a really high temperature, and they've got a significant risk of actually getting a secondary infection like pneumonia. And, when my staff say there's a child who's come in with measles, I say, well, how sick are they? And if they're running around the waiting room playing, they don't have measles. Measles kids are draped in their parents' arms with a terrified parent, and that's what parents don't see anymore these days.
Okay. Thank you for speaking to us, Dr Steve Hambleton, President of the Australian Medical Association. Meryl Dorey is back on the line from the Australian Vaccination Network. The line dropped out. Meryl Dorey, apologies. I don't know what happened there.
That's fine, Neil. It happens. That's okay.
I was about to ask you whether you can tell us the figures and the number of children who have died as a result of vaccination adverse effects, as they say, in the past 5 years.
Well, you see, we don't really have access to that information. ADRAC, the Adverse Drug Reactions Advisory Committee, is one of the bodies that collects those details. And ADRAC has admitted openly that only between 1 and 10% of serious reactions are ever reported. And the AVN maintains an adverse reactions database with over 1,200 serious reactions and deaths. We have 25 deaths on our database. And not
Over
one of
what
these
period
was,
of time?
This is since 1998, so it's quite a long period of time. But also, most people don't know that we have that database, so it's only people who find us. But not one of these reactions was ever reported by the doctor involved, and we've been involved with helping parents get doctors to report reactions.
How many people have died from influenza since 1998?
Very few, very few indeed.
No, I don't agree with that.
Well, what
we
happens
have large
is,
numbers each year.
But what happens, Neil, is that when the government reports that someone died from influenza, they're actually saying influenza-like illness, ILI, and that could be anything.
What?
When they actually test these people to find the presence of an influenza virus, they find that only about 1 to 5% of the people who are diagnosed with influenza actually have influenza.
Are you sure?
Most of the people, I'm positive.
The question. Are you sure you're not
sorry.
alleging a conspiracy here?
No, not at all. If you look at the Centers for Disease Control in the United States, they've been claiming that 36,000 people die in the U.S. every year from influenza. Pardon my voice. And yet, when they've actually done studies to find out how many of those 36,000 are caused by flu, it ranges from between 250 and a maximum of 1,750.
Final question. It's been claimed that you've said diabetics shouldn't have insulin shots. Is that right?
That's not true. That is not true at all.
Insulin?
Well, I don't really know. I'm not an expert on diabetes. I do know that in the medical literature, diabetes is linked strongly with administration of vaccines, and New Zealand saw a 60% increase in the rate of childhood diabetes when they introduced the Hep B vaccine at birth.
Okay.
But I don't say anything about treating diabetes. I am not a doctor. As I said, I'm not a medical practitioner. But, there are people on our Facebook page who say things that I may not have said things like that, but there are people over there who have, and I have not said that.
Meryl Dorey, President, Australian Vaccination Network, and before that, the President of the Australian Medical Association.